Hello and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Casey Minnis for MS Focus. I'm the Director of Communications for the organization. Today, I'm joined by Annette Okai, who will be talking to us about fighting MS fatigue. After a presentation from Dr. Okai, we'll open it up to your questions and your comments. Now, I am delighted to introduce our speaker. Dr. Okai is the founder and medical director of the Multiple Sclerosis Treatment Center at Dallas at Baylor University Medical Center. She is also an assistant clinical professor at Texas Tech University Health Science Center. Dr. Okai is a diplomat of the American Board of Psychiatry and Neurology. She's participated in many clinical trials and is currently conducting multiple trials at her treatment center in Dallas. Dr. Okai has been published in neurological journals and serves as a reviewer for neurological articles submitted for publication. Her professional activities include serving as a member of the Clinical Advisory Committee of the National Multiple Sclerosis Society and the North Texas Leadership Council. She also serves on the Healthcare Advisory Panel of the Multiple Sclerosis Foundation. Her awards include a Patient's Choice Award, actually two in 2009 and 2013, Compassionate Doctor Recognition Awards in 2009, 2013, and 2014, the On-Time Doctor Award in 2014, and she has been recognized as one of the top 10 doctors in Dallas. Dr. Okai manages all stages of MS, and her care philosophy includes using a multidisciplinary approach to patient management. We're very pleased to have her here to discuss this very common symptom of fatigue. Thank you, Dr. Okai, and I will turn it over to you.
Thank you, Casey. Good evening, everyone, and thank you for joining us tonight for this webinar. I'm delighted to be presenting this topic. It's something I talk about almost every day to my patients, and every time there is something new to learn. So I hope that this evening you will take something away from here. And as Casey mentioned, I will be happy to take questions at the end. So let's get started. I'm going to go, here's the outline for the evening. I'm going to talk about what MS fatigue is, then go into the impact of fatigue on lifestyle, the types of fatigue, and how do we typically manage fatigue in MS patients. I must point out here that while this topic is based on fatigue, it can take up 2 hours plus if we really delve into it deeply. So what I have on here may not be an exhaustive a talk about everything about fatigue, but I hope that it hits all the highlights, and then it can be built upon when you are having a conversation with your healthcare provider. Okay, so what exactly is MS fatigue? And it's important to distinguish MS fatigue from regular fatigue. Living in today's world, almost all of us are fatigued. We have hectic lifestyles, we have activities, and a lot of things that demands our attention. So just going through life on a day-to-day basis, people can be fatigued. But there is a specific type of fatigue that is unique to MS patients. So when I'm holding a consultation in clinic, I have to make sure that when someone complains of fatigue, I'm not dealing with regular fatigue, which can be treated in different ways, and I'm dealing with MS fatigue. Now, it's important to point out as well that MS patients also confuse regular or normal fatigue with MS fatigue, and trying to sort out what exactly is going on is important to help the treatment plan go well. So if you don't have such a hectic life, and that's hardly anyone, if you're not running 100 miles per hour, taking care of the job, family, kids, and everything, then taking all of that aside, we then approach MS fatigue. So the definition of MS fatigue is that there is this overwhelming lack of tiredness, lack of energy, and difficulty initiating voluntary effort. So 1 minute someone is going and then moving, and then all of a sudden they just lack energy, or they just become tired. And most people describe that as hitting a wall. They just can't go any further. There's nothing left in the tank. And it interferes with daily activities. So while someone with normal fatigue, they're still tired, but they're able to run around and still get the groceries and do other chores. For someone with MS fatigue, when they do hit that wall, they just cannot do anything after that. It's important to point out that this fatigue is not related to mood. And I will go into that in a little bit more detail later on, because depression can also cause fatigue. So this has to be separate from fatigue caused by mood changes or muscle strength. If you're weak, yes, you're going to feel tired overall, but this is different. You have to have full muscle strength and then you still have fatigue. It is more severe than normal fatigue, and most times is also aggravated by external factors. So right now in Texas, this is June, and I'm sure there are people from other parts of the country, but we're already in the 90s, and the heat can be very overbearing, and that can bring on fatigue. So external factors can aggravate the symptoms of fatigue in an MS patient. Infection, if someone has a urinary tract infection or a sinus infection or cold, it also can bring about MS fatigue as well. So when we're evaluating, as I said, we have to look at all of these factors to determine if it's MS fatigue or normal fatigue or just muscle weakness or any other factors contributing to the MS patient. So, what is the impact of MS fatigue on patients? Over 90% of MS patients complain of fatigue. And that's a huge number. Over 90% of MS patients experience it at some point in time in the disease process. What is so difficult about MS fatigue is that it is one of those invincible symptoms of MS. So, someone who is not familiar with the disease may look at you as an MS patient and think that there isn't anything wrong with you, but they don't understand that you do not have any energy left and you just cannot do what is being asked of you or required of you. And sometimes this may be portrayed as someone being lazy, but that is not the fact. It is really a true phenomena, and until it is explained or someone, an outsider, understands the concept, they may have a different impression of what an MS patient is going through. And due to this, there are people who lose a lot of work hours because they're unable to complete the task. They're unable to get through the day. They can go from 8 to 12 or 8 to 2, and then there's just nothing left in the tank for them to continue to function. And for some people, that may lead to the loss of the job. And that can affect a whole lot of psychosocial things like family, your finances, and social impact. And I also put social impact separately Because if you're fatigued, you take yourself out of most of your social activities. You stop going out with your friends or family because you just don't have the energy to do that. You start making excuses not to be sociable because you just want to go and take a nap, or you just want to go and sleep. As I said, I talk about this every day with patients. And just today, a patient said, I'm so happy I'm working from home so that I don't have to have those secret naps in my office anymore, where the lights go off and people are wondering what's going on in my office when I'm actually trying to take a nap. So this has a huge impact on on the MS patient. It can affect them socially, family life, and also professionally. So it's very prevalent and it needs to be addressed. So what are some of the effects of fatigue on the patient physically? So when you're fatigued as an MS patient, you start to experience cognitive changes. So there is decrease in memory. You have difficulty remembering things. You have difficulty completing tasks. Concentration is also affected. You just cannot focus to do your job. You can't focus to do chores, and those are things that you have to look out for, to also recognize that, oh, I'm not going demented, because some people may think that that is the problem, but it's also due to factors such as fatigue. It decreases the job performance, like I said earlier in this slide before. When you're on the job and you're having these significant fatigue episodes and you cannot complete your job description, then you end up getting write-up or having a bad evaluation because of that. When sometimes all that's needed is to tackle the fatigue, to improve your concentration, to improve your memory, to improve focusing, and thereby being able to complete the chores that you are tasked to do. Another thing that fatigue does is that it causes irritability, and it also makes you distracted. So when you're tired, your mood is also affected. You become very irritable. You're screaming at the dog and forget the kids. All of that are signs that fatigue may be kicking in. And I also tell patients, I say, sometimes you have to listen to your body and you have to listen to what your brain is telling you. So I encourage them to look for certain cues that could say, okay, I'm beginning to feel tired. I think I'm at the end of my energy level for the day. This is happening. I can't remember anything, or I have difficulty focusing. You have that cue, and then you can take steps to help you relieve that. Depression and anxiety is huge, and this is where it's important to recognize the difference between fatigue and depression, because this is a catch-22 situation. When you're fatigued and you start to be less sociable, you're not doing the things that you like, and you're not performing well on the job, that can lead to depression. Then your mood becomes involved. You can be anxious because people are looking at you differently. You are not performing as you expect yourself to perform, least of all what your your supervisor expects, and that can be anxiety provoking. But the opposite end of that spectrum is that when you're depressed for whatever reason, some people have underlying depression. Um, Depression can also lead to fatigue. And so that's where I talk about the catch-22 situation. Is it the chicken before the egg or the egg before the chicken? Were you depressed and that depression is manifesting as fatigue? Or is it because you're fatigued that you're now depressed? And this is where your healthcare provider will have to sort out the two, because sometimes treating depression can improve fatigue, and if you improve fatigue, you can treat your depression as well. So it's a double-edged sword, and that's something that needs to be teased out in your visit with your healthcare provider. So there are different types of MS fatigue. There is the primary fatigue, and then there is this secondary fatigue that occurs in MS. So for those of you who have been on webinars or gone to programs before, you have seen this picture or some iteration of this picture before. If you look at the first picture here, this is a picture of an intact or a healthy nerve. So you have your cell body, and then you have the nerve, which is covered in myelin. And this is important because myelin helps the signal from the brain to the rest of the body to conduct very smoothly, very fast, without any significant interruption. It goes by in nanoseconds that you perform activities or movement without a second thought. On the other screen, you see a nerve affected by MS. So the myelin is now damaged, and you see throughout the nerve axon that you have damage to the myelin. When that occurs, the signal from the brain does not go as well. So it's either slowed down, or is the wrong signal that gets to the rest of the body, or there isn't a signal at all. But even if the signal does get there, the slowing of the signal is what is important. So if that is the case, then your nerve starts to work overtime. So if it takes this healthy nerve 1 second to get the message to the rest of the body, it's going to take this MS nerve, which have been damaged, which the myelin has been damaged, 2 to 3 seconds. And that, when you think about it, if someone is working overtime, in this case, if your nerve is working overtime, you are going to get tired way more easily than someone who is working at a lesser time frame to do the same job. All right, so that's important. That's what we call primary fatigue. So the nerve itself is fatigued because it is working overtime, and when the nerve starts to work overtime, it requires more energy from your body, or it starts to recruit other nerves to do the same job. So while a healthy nerve, you just need one nerve to do it, the MS nerve, which has been damaged, start to recruit other nerves, and you have 2 or 3 nerves doing the same function. And that, because of all that energy required, that really fatigues the nerve out quickly, and then you start to feel fatigue. So that is the primary mechanism for which MS fatigue occurs. The secondary types of MS fatigue can be for a variety of reasons. So when I have someone who comes in complaining of fatigue, the first thing I make sure is that there isn't a secondary cause of the fatigue, because those things are external and they can be treated. The first question is, how are you sleeping at night? That is important because your body needs to rejuvenate, and that's what sleep does for the body. So, lack of sleep can cause fatigue. Even if you were a young, healthy 20-year-old who is used to going on and on with only 3 to 4 hours to sleep, that catches up with you at some point. So imagine if you are an MS patient and you have all these other things going on, that can prevent your body from rejuvenating as it normally would, and you end up fatigued. Your body needs more time because it's using more energy to rejuvenate. And so when you do not sleep as you're supposed to, that causes fatigue, and that leads to daytime napping, daytime hypersomnolence, as we call it, and you're just fatigued throughout the day. There are medical conditions that can also affect fatigue, and I have them listed on the next slide. Then you have medications. Some of the medications that I, as an MS a doctor, prescribe my patients can also cause fatigue, but they are necessary evils sometimes for the patients. I talk about the mood and the depression that can bring about fatigue. And then diet, a poor diet, what you put in your body, can lead to fatigue as well. Certain types of lifestyle, if you're smoking, if there's a whole lot of drinking, or you are not exercising or being involved in physical activity as much, that can lead to MS fatigue. And so those are secondary causes of fatigue. My approach is, if fatigue is the issue and is really impacting the patient, look for all the things that I can make a difference. And most of the reasons for secondary fatigue, I can make a difference in treating those and then improving the fatigue that the patient experiences. So first, what are some of the medical conditions that can lead to secondary fatigue in MS? Well, thyroid abnormality. Thyroid is big because a good amount of MS patients also have thyroid disorders. And even in the general population, for those with thyroid abnormalities, they tend to have fatigue because the thyroid, if it's not functioning properly, can lead to fatigue in healthy patients, and it's even true in patients with MS. So thyroid is something to always look at if someone starts to complain of fatigue. Anemia, low hemoglobin and red blood cell count can also cause fatigue in MS patients. So if you don't have enough hemoglobin to carry oxygen to the rest of your body, you may feel fatigue. For young women with menstrual abnormality, this is something I have to deal with commonly. Make sure that that is not interfering and causing them more fatigue that they would experience. B12 deficiency in neurological patients, we check all the time, and that is also a cause of fatigue. Obesity, so having a higher than normal body mass can lead to fatigue. And this is all of these areas we need to address them if someone is experiencing these and complaining of fatigue. Medications that can cause MS fatigue. First, for those of you who have had MS for a long time, and remember the days of the ABCRs when we had interferons, the interferons were quite notorious for causing fatigue in patients, and we really had to treat the patients while giving them these medications. They needed the interferons, but one of the side effects was fatigue, and then we had to treat the fatigue separately. So MS medication, notably the interferons, can cause fatigue. Our newer medications, we have not seen significant fatigue as a side effect associated with them. So now, if someone is complaining and we find that the medication is, as I said, the interferons are interfering, it's easy to switch them to a medication to help relieve that. Now, MS patients, I tell my patients, I said, when you have MS, it comes with a lot of baggage. Doesn't come alone. It comes with depression. It comes with spasticity. It comes with all the mood changes, vertigo, lots of other symptoms that we can think about. And when it comes with those baggages, we have to treat them separately because the MS medication doesn't treat all of those. You have to do symptomatic treatment. So depression, I keep mentioning depression because it's huge in the population. If someone is depressed and we find that that is the cause of fatigue, we treat the depression, but some antidepressant can also cause fatigue. And that's where your healthcare provider has to be creative and say, okay, I know I have to treat your depression, but I'm going to choose an antidepressant that does not have significant fatigue as a side effect. So that conversation has to be had when all of this is going on. Muscle relaxants for patients who experience spasticity. Um, we have to prescribe muscle relaxants. And and sometimes you can be caught up in a vicious cycle because if you have spasticity, it then affects your sleep. You are not sleeping well. And if you're not sleeping well, that leads to more fatigue. And so we have to treat the spasticity. But medications to treat spasticity can also induce fatigue in some patients. Not all of them, but it's a common side effect. So that's something that has to be addressed when we're looking at causes of fatigue. Is this causing you fatigue? While it's listed that that's a side effect, as I said, not everyone experiences fatigue from all the muscle relaxants. So I'm making general statements here, but there are some exceptions, and it's not 100% that you're going to experience this when you take these medications. We as healthcare providers do our best to make sure that we are minimizing the side effects of most medications when we're prescribing them. Certain times of the year, in the spring, in the fall, when there are lots of allergens and pollen in the air, people take antihistamine because they need to get through the day. I'm always reminded of this commercial where this lady goes to the pharmacist and her head is in the bubble, and the pharmacist pops the bubble. That people need antidepressant to get a clear head so they can get through the day, but the antihistamines also can contribute to fatigue. Once again, we have to weigh the benefits and side effects of prescribing these medications when we do that. Sedatives. Dr. Okai, I need something to calm my nerves. My nerves are on edge, and you know I have MS. My nerves are on edge even more. Or I need to sleep. I'm not sleeping well. And then we get into the cycle. Okay, let me give you something for that. But then that may not, some people do not metabolize as well, and it stays in the system until the next day, and they wake up feeling hungover, or they're not moving as well. So once again, we have to look at all of that. Anticonvulsants, we use that for a lot of symptoms. We use that for pain. We use that for neuropathic symptoms. Those are some of the medications that we look at to make sure they are not impacting fatigue as much. So going to sleep, once again, sleep is the first thing I think that needs to be asked about and addressed when someone is complaining of fatigue. Because it is well known that over 50% of MS patients have sleep problems, and it can be due to multiple things. First, just generally, it's just difficult to sleep, but symptoms of MS that can contribute to poor sleep, urinary frequency. If you have to get up 3 or 4 times at night to go to the bathroom, that's interrupting your sleep. So when I ask someone, how are you sleeping at night? Oh, I sleep 7 hours. Are you ready? Are you really sleeping 7 hours because you go to bed at 10 and wake up at 5? Or are those 7 hours interrupted because you got up 3 times to go to the bathroom? So urinary frequency, urgency can impact sleep. Spasticity, I mentioned before, when you're stiff and your muscles are not loose and they cause pain, that can affect your sleep because you have to turn all the time to avoid being in one position and getting stiff. If you're having pain, the pain is affecting the quality of your sleep. Restless leg syndrome, another issue that some MS patients experience, and that can also affect sleep. So we have to find out why is sleep affected. If that's the case, sometimes and most times I send patients for sleep study to say what is going on here. And if we can treat the sleep problems, then your body have time to rejuvenate and you don't wake up and you don't feel fatigue as much fatigue through the rest of the day. For those with mobility issues, walking difficulties can lead to increased energy use. So if your walking mechanics aren't in the normal range, you tend to use up more energy when you try to walk, and using up more energy, you tend to be tired more. Deconditioning, if you are not using your muscles, for people who have been in bed for a long period of time or sitting or those wheelchair bound and they're not doing passive exercises. But even those who are just tired and they just tend to lie in bed, then your muscles become deconditioned and then you become even more fatigued. So that's something to take into consideration. And once again, you see depression on the screen. Depression is also a major factor that can contribute to MS, and that needs to be talked about. And I said talked about because some patients don't like to talk about mood. Some patients don't like to bring it up with the doctors, and some patients don't like to take antidepressants. But if it's not treated, then we aren't taking care of the fatigue that can come with it. So in order to manage the symptoms of fatigue, I try to have the patient understand what's going on. When you understand what's going on, then you understand what needs to be done and how we can help the situation. So if you look at the screen, for a healthy individual, if they have good sleep, in the morning, this is the battery analogy. Some of you have heard about the cell phone or the battery, but the battery analogy, you wake up with a full battery. If you're healthy and you sleep well, no issues, your battery starts at 100% when you are walking out the door. You go to work, you mentally you use up a lot of energy as well as physically, but because you started with 100%, by the afternoon you still have about 75% of your battery life left, And by the evening, you got 50%. So you're not looking for a charger to charge your battery. You're not in the red zone. And by the time you go to sleep again, you still have more in the tank that you charge faster, your battery charge faster. But what happens in an MS brain, in an MS patient? Okay, so once again, you're using all these nerves and they're working overtime. So in the morning, if you take longer to rejuvenate, and if you're only getting 4 to 5 hours, and not 8 or more, you wake up, your battery is at 50 to 75%. So you are not starting out at 100% compared to someone who nerves are intact. By the afternoon, you are down to 25% or even 17%, and you're looking for a charger. How can I recharge? And if you don't recharge, you don't have time to get a nap in the afternoon. You don't have time to take a break. By the time evening gets around, there's nothing in your tank. Your battery levels are in the red. And then at night, because you're in the red, it takes longer to recharge. And who knows, by the time you wake up, you are not at 100% again. So that's how you think about your nerves, the nerve fatigue that occurs because of MS, and what is happening with your energy level. So now that we have that analogy in play, that you are not starting at 100% because even if you do, your nerves are working overtime. Let's see what we can do to manage the symptoms. So how do we manage fatigue? Once again, I talk about sleep. Sleeping is important, making sure there's good sleep hygiene. If someone is having urinary frequency, reduce the amount of time in the times to go to the bathroom at night. So put them on medication so they're not getting up at three times a night or 4 times a night. Once a night, that will be a good result. Okay, so once you work on the sleep, whatever symptoms are impacting the sleep, if it's spasticity, if it's pain, if it's urinary symptom, you work on the sleep and you're able to charge sufficiently. The next thing I consider is physical therapy. And when I say that, patients look at me and say, well, Dr. Okai, I just told you I can't get out of bed. I'm so tired. But while it may seem like contradictory, when you do physical activity, it actually helps you build up endurance and you feel less fatigue. So, physical therapy, occupational therapy to help with all those movements that are normal is important to build up endurance and to help you get your energy level back. If physical therapy, the person cannot go out to physical therapy, I encourage physical activity with yoga, with aqua therapy. Aqua therapy is very good for people with spasticity. So when I prescribe aqua therapy, I'm thinking, okay, I'm going to treat spasticity if that's the problem here. And by treating spasticity, I'm improving sleep at night, and then the water itself can help build up energy levels. So I'm attacking it from all different levels. So it's important that for me that I do not start right away. Here's a medication for fatigue, because sometimes it's just putting a band-aid. If I give you a medication for fatigue, but you're not sleeping well, then it's causing more harm than good. If there is a medical condition that's causing the fatigue, that needs to be treated. So if thyroid is affected, thyroid is treated. If anemia, low hemoglobin, make sure the patient follow up with their primary doctor to address the cause of this and treat it. If B12 deficiency is an issue, we treat B12 deficiency. So treating the medical conditions Doing physical activity, all of those are non-pharmacological intervention that people can do to help improve their energy level overall. Stress is huge. If you're stressed, you're gonna get tired. Mentally, when you have mental stress, it takes a whole lot out of you. If you are physically stressed, it takes a whole lot out of you. Once again, you have to be able to identify what's affecting you, listen to your body, and then try to minimize that. Okay, so if stress is very high, we try to have counseling, try to have other intervention that can reduce the amount of stress. Some stress we bring it on ourselves. We don't know how to say no. We don't want to say no. And for some MS patients, they think they're a superwoman or superman and not doing what is needed. People will think less of them, but you have to recognize that you have to treat yourself first before you can treat others, and before you can be there for others, you have to remain healthy. So identify the cause of the stress, recognize the effect the stress is having on you, and then take action to reduce the stress. Dietary and lifestyle management. I talk about obesity, also a cause of symptoms. Work with your doctor, work with the nutritionist in order to promote healthy eating, because what you put in your body is what you're going to get out. Processed food is notorious for causing fatigue. So trying to reduce processed food is good. Sometimes people treat their fatigue with sugar. So you get the sugar high, but then you come crashing down. That you don't want to get into that habit of doing that. Caffeine Caffeine, yes, I treat my fatigue with caffeine, but caffeine can also cause you to crash as well. Now, I'm not saying that you cannot have caffeine. In the morning, you can have your cup of coffee, and caffeine should be in moderation. But you don't want to be drinking caffeine throughout the day, because if you drink caffeine late in the day, then what happens? It affects your sleep. Then you don't sleep well. And if you don't sleep well, your body doesn't rejuvenate, you don't recover, and then you end up fatigued. One thing people really take for granted is hydration. And I'm speaking to my MS patients out there who have bladder issues. So for MS patients with bladder issues, they don't like to hydrate because they go to the bathroom a whole lot. Well, what happens when you are dehydrated? You get fatigue. And it's counterproductive, because if you aren't hydrating and your bladder isn't being empty frequently, then that leads to infection. And when you have infection, that gets you fatigue. So hydration is key. It's better to have frequent urination, frequent clean urination, than not hydrating at all and being dehydrated and feeling fatigued. Water is very important for a healthy lifestyle. And then I talk about physical activity, because physical activity, which I mentioned on the last slide, can help improve endurance. And when you improve endurance, your fatigue gets better. Okay. Medication streamlining. So sometimes it's just good to sit with your healthcare provider and say, what are all these medications necessary? Can I do without this medication? Can I try to take this medication out of my routine? And sometimes you may need the muscle relaxant. You may need the antidepressant. You don't want to stop everything just because you're fatigued. We strike a balance in how much you can take and how much fatigue is there. When all of those interventions have been sorted out, when you're not anemic and your thyroid has been addressed, and other issues have been streamlined, then we look at the pharmacological interventions. Okay, what medications are there that can help with fatigue? Well, the first thing is there is no approved therapy to say this medication treat MS fatigue. Everything we give, we prescribe, is used off label. So that's why when your doctor order your provisional or individual, your insurance company denies it because they say, well, this isn't indicated for MS. Even though it works with MS, we know it works in MS and we have used it so many times. They'll say there isn't an indication for it. But if insurance company does pay for it, we have several options. We have amantadine, we have modafinil or armodafinil, which is provisional individual. For some doctors, they use Ritalin, Adderall, um, and sometimes Ampera, which is not approved for MS fatigue, can also help with that as well. And there are different other things that we promote that we prescribe rather to help patients cope with fatigue after we have treated other issues. So talk to your healthcare provider. Is this the right one? Do I need it? And what the insurance company will cover is what you get. But there are medications that we can prescribe for that. I usually advise patients don't just rely on the medication, but physical activity and good sleep hygiene is important in addressing fatigue. You have to take a whole approach and not just one. Energy efficiency. So you also have to make things work for you. How do you conserve energy? Once again, you don't want to be the superhero when you aren't taking care of yourself. So you plan ahead. Make sure you plan all your chores ahead, and then you prioritize what needs to be done, and that's what it is. What needs to be done, or what can wait. Okay, and then balance it out. If this task is going to take a whole lot or requires a whole lot of energy, you want to do it at a time when your energy level is higher. So, and if that task needs to be done, you do it at a time when you have the energy to do it. The next thing, and this is tough for MS patients, is to ask for help. It's not a failure to ask for help. That people are willing to help, and sometimes you can delegate how much work you do. Delegate to family members, delegate to coworkers, or ask for help if needed. But it's important to do that because you cannot do it all on your own. Avoid triggers. Avoid triggers. You don't want to be out in the heat for a long period of time if you know that's a trigger for fatigue. You don't want to overdo it if you know that's a trigger for your fatigue. Okay, so you have to balance activity, you have to prioritize, and you have to delegate and ask for help if needed. All right, so I'm coming towards the end, Casey. We may go over a few minutes, but that's okay with me. We're coming towards the end. So, what about fatigue at work for people who are out there in the workforce? What do you do? Do you tell your employer you have MS and you need accommodations? What do you do at work? Well, you don't have to disclose. It all depends on what you want to do. That is the first thing. You can disclose or you cannot disclose, but you have to work with your healthcare provider to make sure that your employer have accommodations in place for you. And some of the things that I have done for my patients is to request frequent rest breaks for them. So instead of just a lunch break for known to one or something, probably they need more frequent breaks, 15 minutes here, 15 minutes there. And that's something that can be put in as an accommodation. One thing is parking spaces, to get a parking spot closer to the door of your building as opposed to a parking garage where you have to walk over 100 yards just to get to the door. Flexible work hours. One silver lining for this COVID pandemic is that for years I've been fighting to get my patients to work from home 1 to 2 days a week. Now, everyone who's in the workforce, oh, you can work from home. It's okay if you work from home. So, this is one silver lining from the COVID pandemic for my patients. What can you do at work? Proper posture can help you as well. And then you have to organize your space. Okay, for some people, while they were at work, you want to be closer to the bathroom so you're not walking a long distance to the bathroom. Make sure that what you need at work in terms of paper, supply, and all of that is organized closer to you as opposed to you having to go a distance to get those things. So organizing your work and living space is important in also making things accessible for you and conserving your energy level. All right, so the last two slides, some helpful tips to remember. Fatigue can be very frustrating. It can lead to mood issues, irritability, because I used to do this before and it wasn't a problem for me, and now I can't do it anymore. Well, the first thing is you have to realize that you do not have the same physical and mental stamina that you did prior to your diagnosis. So think back to the battery example that I give. You are not waking up with 100% like someone who has a healthy nerve. You do not have the same mental and physical stamina. So you have to realize that, because if you keep comparing yourself to before diagnosis and what you could do, that leads to more frustration. So once you realize that, then you have to say, okay, what is my body telling me? You recognize the signal that your brain is sending to say you are fatigued and it's time to take a break. When your concentration starts to go down, when your memory starts to go off, or the words aren't coming out right, that's your brain telling you, hey, take a break. Recognize what your trigger is, recognize what your signal is, and then take action to avoid being in that red hole. Just like your cell phone, you see the battery is going down, you limit how much you use it because you don't have your charger at hand. You do that with your body as well. The one mistake you do not want to do is to try to push through thinking you can overcome your fatigue. Or I will just push through it. I will just push through it. You don't have anything left in the tank. Take your rest period to try and get back up. Okay, stop using the phone for 30 minutes so that your battery levels can come up. Stop, take a break so that your body can rejuvenate. Organize, prioritize, and delegate. Organize, prioritize, and delegate, and that will help you in the long run. So to summarize, MS fatigue can be very debilitating. It can lead to frustration, but we have ways to identify it. When we identify it and we figure the cause of it, then we can help direct treatment. We can treat it well. And then when you make those changes, including lifestyle changes, that can help improve the symptoms of fatigue. And with that, I will stop there and take questions. Casey?
All right, thank you very much. We really appreciate that presentation. Now we are open for questions. If you have a question, you have two ways to ask your question. You can ask it in chat, and I will read those questions out for you, or you can use the raise hand feature. In the app, you will
Casey, you're mute.
sorry, hit the button there. You can find that by touching your screen or clicking the screen, and you'll see the menu bar come up. You'll see the more button with the dot, 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 and there's an option to raise your hand. Once you raise your hand, I will click the button that asks you to unmute. You have to give me permission to do so. So a yellow button will come up on your screen, and you can click that button. Okay, we have a question from Tammy. Tammy, go ahead, please.
Hi, I have been in a water aerobics class for years now, which has been wonderful. But since March in the pandemic, everything's closed and public pools are not one of the things that are not opening. What can we do for our aerobic water exercises that where I feel safe and comfortable, and now I can't? So I'm confused as to what to do now.
Well, if you don't have a pool, then that is an issue. But in order to stay physically active at home, especially during this time, I will say make use of the MS Foundation, the MS Focus videos on YouTube. So all the MS organizations have exercises that you can do at home safely. Just go to YouTube and all their websites, and that would direct you in where to go and doing the exercises to keep healthy. Now, I know aerobic exercise is good for spasticity. The water is nice, but if your only access was the public pool or with the program at a facility that's not open, I will still encourage you to keep active, but make use of the tools that we have on the website to help keep you going.
Okay, so if I'm not swimming, and the reason why the water is so good for me is that I don't have the strength to, I mean, the buoyancy is wonderful, and that's
Yep.
what I need. If I'm doing exercises outside the pool, lifting my leg is almost impossible. So that's where I'm at right now, is I'm confused because I can't do what I think I should be able to do.
And I completely understand. As I said, the water and what you described is the perfect exercise for you right now. But that's not an option. But if you do look on the website, there are physical activity for all levels. So even if you have weakness in your leg and difficulty lifting your legs, there is still activity for you to do. Is for all levels. There are some people who are able to do more if they're more mobile, and some people who are less mobile. But for all levels of ability, the society, the foundation, they have exercises for you.
Yeah, absolutely. There are some great yoga and chairs programs out there that we can help you find. Everyone who's attending has my email address. If you reply to the invitation that you received with the link to this program, you can email me and I'll help you get connected with some of those materials. All right, we have a question from Moya. Any supplements you can recommend?
Okay, so I tried to tell my patients not to get carried away with supplements. I prefer that you eat a healthy meal where you, as opposed to supplements, because when you think about it, supplements, they have to go and process the food, and it's all processed, and they put it in a little capsule and say, here you go. But for some people, they may not have all of that, and they prefer to take a capsule. What I do recommend is that make sure vitamin D is in your vitamin level, your vitamin box. That's the one thing as an MS patient you want your levels to be up on. So vitamin D. And then other supplements out there, I hate to do this, but things that I will say you can use is alpha lipoic acid that helps with energy level as well. That can be found at health food stores, also help with numbness and tingling and stuff like that. Now, you have to realize that the effect may not be the same for everyone, but you can try it. It's not harmful. Before you start any supplement, it's good to talk to your healthcare provider, because there are some supplements that for MS patients we do not want you taking. Vitamin B12, vitamin D3, alpha lipoic acid, those are things that are safe for patients. And there is also a guide I could, there's a whole list I really can rattle off the top of my head right now. But those are three main things that I will say you want to be really up to date on.
Okay. It looks like we may
Kathy
have
has her hand up. She's had it for a while.
Let's get Kathy on the line.
Yeah.
Kathy, I've asked you to unmute. You should have a yellow box on your screen that will allow you to allow me to unmute you.
Okay. Can you hear?
There you go. We can hear you.
Okay, I'm in a real dilemma. I just recently had my MRI done, and I have new lesions in the frontal lobe of the gray matter of my brain. And I also had surgery done on I had a total knee, and I had a humerus operation. This is all a result of an accident I had. And when they did the arm surgery, they pinched a nerve, and so it affected my hand, and I have a numb hand. And all of this has resulted with the fatigue I have. I have a real hard time getting up. I'm very weak right now, and I'm having a very hard time getting up to do any kind of exercise, because everything I do hurts so much, so much pain.
So that's why with your healthcare provider, I think you noticed that I have pain on there. Pain can cause fatigue, can interfere with sleep and all of that. So with your healthcare provider, the best thing to do is to discuss treating the pain first, reducing the pain level, which sometimes physical therapy can help with that. So reducing the pain level and then trying to treat the fatigue. But something has to be addressed, otherwise you will become deconditioned and then more fatigued.
Yeah, I'm using CBD cream on my joints and on my legs, because I have neuropathy on my legs too. I have so many conditions, it's making it hard for me to move at all.
Yeah, and those conditions can interfere with stuff. So that's why they have to be addressed by your healthcare provider in order to help you move along.
Yes, and I'm going to see my neurologist tomorrow, so I'm going to address all of this. So thank you very much. And do you know anything about finding any lesions in the gray matter?
So lesions can occur in the white and gray matter when you have MS.
Okay. All
Yeah,
right. Thank you so much.
you're welcome.
Okay. And we have a question from, oh, now I lost it, from Scott, who would like to know, is there a test for a difference between MS fatigue and normal fatigue? How do you tell the difference?
So there isn't a specific test for MS fatigue, but if you explain your symptoms to your healthcare provider, usually they're able to differentiate. That's why the questions come, do you asking the types of questions that are necessary to help distinguish the difference, the healthcare provider is able to do that. And sometimes when you do your routine blood work, like certain things can be found on blood work, like when they're checking your blood work. For most of you that are on medications, you have to get blood work. They can find out if you're anemic. That's part of the regular profile as well. So sometimes the regular blood work that we do to monitor your medication, we can also see if there are abnormalities on there that can explain if there are any other issues causing the fatigue. But in terms of, it's all about asking the right questions and being able to determine where it's from. So if someone said the fatigue, I'll say, how are you sleeping at night? And then if they talk to me about sleep, then okay, sleep is what's contributing to this. Or I do the blood count to see if they're on one of the pills, and I do the blood count and I see the hemoglobin is low. I say, okay, you're anemic, and that could be causing this. So it's all the interaction with the healthcare provider, the questions they're asking, and the tests that they do for other things that can help differentiate the fatigue level, cause of fatigue.
Thank you. And now we have a question from Michael. He asks, do you have an opinion either way on CBD in helping with fatigue?
Okay, so CBD and MS, this comes up all the time. And so the rules are different in different parts of the country. But once again, research is very limited when it comes to CBD, but the two things that we do know in MS, at least that have been proven by research, is that CBD helps spasticity and CBD helps pain. And on my slides, you saw that spasticity can lead to fatigue, and pain can lead to fatigue as well. So if CBD helps someone's fatigue and it helps someone pain, then by extension, that fatigue is you're going to see some improvement. But I will prescribe CBD just for fatigue. Because if you think about it, marijuana itself makes people mellow, so that could have a different kind of effect as well.
Okay, thank you. And now we have Aaron says that he has a question. All right, Aaron, I've asked you to unmute. There you go.
Hello, doctor.
Hello.
I have primary progressive MS, and I found out about 15 years ago. I was able to hide it from my employer for 10 years, and my fatigue and walking ability, my gait, ratted me out. And I failed physical testing and was put on indefinite medical leave. I have tried amantadine with Adderall. I've tried amantadine and Ampera and modafinil, and nothing seems to help. I used to go to the gym when the gyms were open. I would get up in the morning. I would take caffeine pills, pain medication, and uh, albuterol to weight train and do some swimming. But of course, I can't do that now because of this COVID mess. But even before that, I still have problems with fatigue. My blood work is normal. I'm not anemic or anything. Don't have thyroid issues, and I just don't know what else to try.
So, and that's a tough situation. It seemed like, you know, with primary fatigue, primary progressive, once again, you know, if you're saying everything else has been ruled out, you know, your nerves are just working overtime. But I think one thing to realize here is that fatigue is not going to go away, right? Because the nerve has been damaged and it will always be working overtime. And I'm going back to the battery example where you're starting at 50%, whereas a healthy nerve is starting at 100%. So we can never take away fatigue. The goal is to lessen the impact and lessen the amount, the impact that it has on lifestyle and try to get you through your day. So once again, sometimes you need to take a step back and say, okay, what is the goal here? Is the goal for me to, you know, and this is just an exaggeration, I'm being extreme, but to run a marathon, or is the goal for me to go down the block? Okay, so with MS, and it seemed like you've had MS for a long time, you, once again, your nerves are working overtime. It's never going to be back to 100% where a healthy nerve is. So the goal, the goal of managing fatigue is to try to get you through the day or certain parts of the day so that you're able to do that. And sometimes it may take recycling through meds. Sometimes, you know, you just have to talk to your healthcare provider and say, okay, what have we looked at? What haven't we looked at? And let's restate our goals. And those goals should be goals that are attainable. That's what I will recommend. Because once again, no approved therapy for MS fatigue, and we just use the drugs that are there to see how much benefit you can get from it.
Okay.
Okay.
Well, you know, my goals are pretty simple. I mean, I'm in my 50s. I just want the energy to be able to play with my dogs or take my son, my 15-year-old son fishing, you know, very simple things. I walking is out of the question for me, even on the Ampera. Um, I can't stand for very long periods of time. I can't walk very far. I, of course, like everybody else, look like I'm drunk when I walk. But you know, but that's I have very simple goals, and I can't. I have a hard time achieving those.
Unfortunately, I can't, you know, I can only advise you on strategies, but in terms of looking at your goals and what you have already done and what needs to be done, then that has to be an in-depth conversation with your healthcare provider. What I've provided here, as I said, is not an exhaustive list, but it's information to get the conversation started and say, okay, where do I go from here? So I won't be able to help you attain those goals on this webinar, but I hope that the information that you get from here will help you talk to your healthcare provider and say, okay, let's look at this again and see how we can help me be with my 15-year-old or whatever goals else, whatever goals you stated before.
Okay. Thank you, doctor. I do have an appointment with my neurologist next week, and I'm going to put an appointment with my MS doctor as nurse practitioner in 3 weeks. So I'll be able to talk to both of them, and they speak to each other. My MS doctor, my neurologist, and my primary, they speak with each other. So
Okay.
I'm really appreciative of that. They all work together for my health.
Yeah,
You
and
know,
that's important to keep the team informed.
okay. All right. Thank you,
Thank,
doctor.
thank you, Aaron. Well, we have quite a few people extending their thanks and appreciation for you, Dr. Okai, in the chat.
Well,
And
thank you all for being on here as well.
Raj asked how people can contact you.
Well, I'm in Dallas, Texas. And I'm at Baylor University Medical Center. Contact me.
What is the proper name of your center so people know where to reach you?
Oh, the MS Treatment Center, Baylor Scott and White Hospital. And that's downtown Dallas.
All right,
Yeah,
thank
so
you
if you're
very
in the
much.
Dallas area, it's the Baylor University Medical Center in downtown Dallas.
Thank you so much, Dr. Okai. I want to remind our listeners that if they missed any part of this teleconference, it will be available on the MS Focus YouTube page. All of our webinars are recorded and posted. It usually takes 1 to 2 weeks to get through the review process. So we recommend that you search for Multiple Sclerosis Foundation on YouTube and then click that little subscribe button. You'll get a notification when new programs are posted. I'd also like to invite our audience to join us again on Thursday afternoon at 2 p.m. Eastern. That would be 1 p.m. Central, noon Mountain, 11 a.m. Pacific. And that program will be a speech and swallowing program with a speech language pathologist, Marissa Barrera. I'm putting the link to register in the chat so people can click on it directly from there if they would like. So now as we close, I just want to extend my thanks to everybody for your attention, your participation this evening. We appreciate all of our audience members, but most especially our thanks to Dr. Annette Okai for this helpful and thorough presentation. Thank you, Dr.
all.
Okai.
It's been lovely hosting this webinar. I enjoy you guys. I enjoyed talking about it. And Casey, thanks to the foundation and everything you all do and continue to do through this trying time for our patients. I'm just appreciative of my patients that they're still able to call you guys and do and the work that you're all doing. So from me and for all the patients I treat, and I'm sure I speak for everyone, thank you to the MS Foundation.
Oh, thank you so much. We know those needs in the MS community don't stop, so we don't stop either. All right, folks, I'm going to mute and then unmute everyone. So if anyone has any final comments they'd like to express their thanks to Dr. Okai, we'll let you all do that. And suddenly it won't let me unmute everyone, but you are allowed to unmute yourselves now. So if you would like, if you have any final comments you would like to make, feel free to go ahead and unmute yourselves.
Thank you very much, Dr.
Thank you
Okai.
very much.
You did a
Thank
wonderful
you.
job.
Thank
Very
you.
helpful.
Appreciate it. Thank you.
Can you hear
right.
me?
Yes.
Thank you for your time.
Thank you.
Thank
And
you
all the
guys. And
Thank
everyone
you.
stay
Wonderful.
safe, okay?
you. You too.
Okay.
Bye-bye.
Bye now.
Bye.
Good night, everyone.
Mm.
Good night.